Thanks for tuning in to Pregnancy Pearls with me, Dr. Plenty. Today, we're going to talk about diabetes and pregnancy. So, for the purposes of this talk, I'll talk first about people that have pre-existing diabetes, meaning you have type 1 or type 2 diabetes. Then I'll talk about what gestational diabetes is, and then give you some general tips to make it safely through the pregnancy with those diagnoses. So first, if you have pre-existing diabetes, that means that you have either type 1 or type 2 diabetes. The most important thing with type 1 or type 2 diabetes is making sure you are well controlled before the pregnancy starts. What does control mean? It means that your hemoglobin A1C value, or the value that tells us your average glucose level for the past 3 to 4 months, is controlled at a value of less than 7%, with 6% being the goal for pregnancy. We know that people that have diabetes with a hemoglobin A1C level above 8% have a much higher risk of having a baby with a structural malformation than those that are well controlled. If your hemoglobin A1C value is below 7%, that means that your risk of having a baby with a structural problem or a birth defect is the same as somebody that has no complications in pregnancy. So our goal is to make sure you get safely through the pregnancy by making sure you are tightly controlled before the pregnancy. Remember, the organs start developing really early in pregnancy. By 5 to 6 weeks, you can see a baby's heartbeat on ultrasound. By 12 weeks, the spinal cord is already developed. So by the time most people realize they're pregnant, it's too late to stop birth defects from uncontrolled diabetes. So the most important thing is that your hemoglobin A1C level is controlled at the very beginning of pregnancy, which means that it needs to be controlled before you get pregnant. Also, people that have pre-gestational diabetes should start folic acid supplements 2 milligrams before you get pregnant. That will reduce your risk of having a baby with open neurotube defects, or also called spina bifida. Let's now talk about gestational diabetics. So if you have gestational diabetes, you don't have the same risk as somebody that has pre-existing diabetes to have a baby with a birth defect. But you do have risk of other complications happening. You can't go backwards and create a birth defect. So if you have gestational diabetes, you're out of that risk pool. But you can still have an increased risk of other complications, such as preeclampsia, which means that you have high blood pressure and vascular damage in pregnancy, gestational hypertension, meaning you have high blood pressure in pregnancy, having a big baby, meaning or macrosomia, okay, which puts you at higher risk for having a C-section, and you have an increased risk of stillbirth if your blood sugars are not well controlled during the pregnancy. So it's really pertinent that pre-gestational diabetics and gestational diabetics remain well controlled throughout the pregnancy. Tips for maintaining control during the pregnancy: 1, make sure you're checking your finger sticks when you're supposed to. So fasting, meaning the first thing when you wake up, should be 95 milligrams or less, 95 milligrams per deciliter, or less fasting. Or a 1-hour value of less than 140 milligrams per deciliter, or a 2-hour postprandial value, or 2 hours after you eat, less than 120. That means that you've maintained good control and that you have a decreased risk of having a stillbirth. Also, lowering your blood sugar can be achieved by just taking a walk around the block after you eat. That'll, 1, allow you to be able to eat more, and then 2, help with your energy level, and then 3, decrease the level of glucose getting to the baby, okay? Next, if you're not controlled, making sure you're compliant with your medications. So if you are diabetic and you had it before pregnancy, most of the time that means you're either on an oral agent or you're on insulin already. So making sure that you're following a diet and then getting your levels checked regularly is very important. Most of the time you will have to go up on the amount of medicines you're taking just because of hormones secreted from the placenta. So it doesn't mean that you've done anything wrong. It just means that you're a little more resistant because of those hormones from the pregnancy. So being compliant with the increases in medicine is really important, and making sure you follow up with your doctor so they can adjust your regimen frequently is also really important. For gestational diabetics, the same thing. Sometimes gestational diabetics can just be controlled with diet and a little exercise. But if you're not well controlled, it's very important not to be reluctant to start medicines. The goal here is to make sure you're controlled and you get to a safe point in the pregnancy so you can take a baby that's healthy home. If you're not well controlled, meaning your fastings are much higher than normal, then your doctor may talk to you about being delivered earlier than normal, okay? So if you're not controlled and they can't get controlled, you may have to get delivered before 37 weeks. 37 weeks is full term. If you're mostly controlled, but we're still making those last minute adjustments, then your doctor would talk to you about being delivered in the 37th week. And if you're well controlled, in the 39th week would be where you need to be delivered. If you're a gestational diabetic and you're not on anything, then you can go all the way to your due date safely without being delivered. People that are taking medicines in the pregnancy need to be monitored very, very closely in pregnancy. So in your third trimester, your doctor will talk to you about getting frequently tested during that process. So frequent testing may mean they do a non-stress test or putting you on the monitor to listen to the baby's heartbeat for about 30 minutes twice a week, or a biophysical profile, which is an ultrasound to look at the breathing, movement, fluid, and tone of the baby to make sure all of those things are normal as the pregnancy progresses. Also, gestational diabetics and pre-gestational diabetics may have to see someone like me to make sure that everything is normal throughout the pregnancy. Pre-gestational diabetics, or if you have type 1 or type 2 diabetes, you should be seeing someone like me, a maternal fetal medicine specialist, to make sure that structurally at 20 weeks, everything is completely normal during the pregnancy because of your higher rate of having a baby with structural malformations. Pre-gestational diabetics also need to make sure your heart function is normal before the pregnancy, and they'll also recheck that during the pregnancy. So these are all the things that you need to know. Making sure you're well controlled before pregnancy, if you have pre-gestational diabetes, is the most important thing to get you safely through it. And if you have gestational diabetes, making sure that you're controlled through the rest of the pregnancy is key to getting you safely to your due date. Thanks so much for tuning in. And please watch the other videos and stay tuned for more. Thanks. Thanks for watching the video. You see that little click and subscribe below? Go ahead and click subscribe on the YouTube page. That way you can get all the latest videos as soon as they're posted. Also, don't forget to go to www.pregnancypearls.com, scroll to the bottom, enter your email address to subscribe to my blog as well. Thanks for tuning in.